Hi, today we are going to be talking about points of distribution and how they apply to the Vermont Department of Health and the Medical Reserve Corps. This is a class that your unit coordinator usually offers in person throughout the year. We strongly recommend that you do the in-person course because there are some sections that are interactive that you will not get the benefit of on this pre-recorded presentation. However, this presentation does suffice to meet the mandatory requirement. So what is a point of distribution? A point of distribution, otherwise known as a pod, is a location that has agreed to host the Vermont Department of Health for distribution of medications or vaccines during a public health emergency. These sites may be open, which means that they're available to the public, or closed, in which case they serve first responder agencies, local businesses, or critical partners. Today we are going to be talking about open pods, which are those that serve the general population. The goal of a pod is to quickly and accurately distribute medication or administer vaccines when there is a crisis that necessitates it. These are designed for worst case scenarios. So we expect that folks during normal times will go to their primary care physician or a local pharmacy to receive the medications or vaccines that they need. But if there was a large scale event that necessitated rapid prophylaxis of the public, pods would be opened in response. Currently, there are 68 strategically located points of distribution within the state. These are spread throughout all of Vermont's 14 counties and encompass many cities and towns within our state. Additionally, our 12 VDH district offices can open up small localized pods within their office spaces. So you may ask, how does a pod work? The idea is that there are two different methods that we can distribute medication or vaccines. The most common is something that we call a head of household model, and this is used for medication distribution. The idea is that one person from the household, deemed the head of household, would come in to receive the medication for their entire family. They can also include friends or neighbors so long as they have basic medical information about those individuals that they can provide. Head of household model is more rapid than having every individual come through because we can distribute medication to a single person who will then go back to their locale and distribute it to others. It allows for an individual to pick up medications for as many persons as they feel comfortable with. A vaccine pod, on the other hand, does require every individual to come in. Because the head of household cannot provide a vaccination to folks within their household, it is incumbent upon the public to have every person needing vaccination go physically to the pod site. Generally, pods have a specific layout. These do change depending on the venue that they're located in, and they can expand and contract depending on the number of people being served and the location specificity. But in general, all of your pods will have some basic areas that we want you to know. First and foremost is a triage area. This is the location where we greet members of the public as they come in. If they have pre-registered for an event, we can check them off of the roster. If not, then we would make sure that we capture their information. If there are any preconditions for them entering, such as temperature checks, so on and so forth, symptoms checks, we can ask preliminary questions at a triage site. Next, our individuals would go to an intake section where they would be filling out the paperwork that's involved in the pod. We provide forms that they are expected to complete and assistance completing those forms if they are having trouble understanding them or writing their responses. This is the location where we decide the flow of where an individual might go. Typically, there are going to be multiple lines where people are providing medication or vaccination. And if we find on the intake form that they have an allergy to a particular type of medication or some other restriction that prevents them from getting a certain medication, we can cue them to a different line where something else might be available, for example. Once they are triaged to their appropriate line, they go to a medication screening and distribution section. These are where our medical providers and the people they are overseeing are giving out either the medications or the vaccines. These individuals are responsible for reviewing the forms, having a dialogue with their patient and answering any questions that individual may have, distributing the medication, and providing any follow-up information such as side effects or what to do if they have questions further down the road. Once they have gone through a screening and distribution section, if it is a medication and they'll be taking it at home, they are welcome to leave the pod site. If it is a vaccination, then typically there's going to be a mandatory observation period to make sure that the person is non-reactive to the vaccine. So the exit station may be set up to monitor patients for a 15 to 30-minute period, for example, with a medical professional available should they have some form of reaction. These types of pods can expand and contract, as I mentioned, and there are other stations that can be set up to provide additional wraparound care to individuals who are entering the pod site. So the idea of a pod is rapid distribution. All pod sites utilize a rapid distribution protocol, which the following functions are provided by means that minimize the need for medically licensed personnel at the pod site. We know in times of emergency that trained medical professionals are going to be few and far between. So the understanding is that medical professionals will oversee the necessary parts, but that non-medical individuals with good client care background and good record keeping skills may be able to take on some of the functions that would normally be provided by a medical professional, such as directing clients through the pod site, deciding which medications to distribute, disseminating information, and distributing the medication. For a vaccine, many of these positions do need to be medical just by the invasiveness of the procedure. Now I want to talk a little bit about dispense assist. In many medication or vaccination scenarios, we are going to be working off of paperwork that is tailored specifically to the event-specific information. However, the federal government has created what we call the Dispense Assist program for high consequence biological or chemical agents in case of a terrorist attack. If it were one of these types of scenarios that Vermont Department of Health and the MRC were responding to, we would use the Dispense Assist paperwork to be able to allow folks at home to fill out the paperwork in advance and bring it in already completed for submission. So Dispense Assist is an online tool that people can access from their home. It allows them to create a medication voucher with what we call POH, which is personal identification history, such as their name, address, phone, and a brief health history. These Dispense Assist forms are available in case of anthrax, tularemia, or plague, which are the three most common biological agents we would anticipate being deployed in the United States. Dispense Assist use this information to pre-triage folks into two categories, those who would receive doxycycline or those who would receive ciprofloxacin. Or it would notate that they aren't able to receive either medication, in which case these individuals would need to go to their provider. The individual would print the voucher, bring it to the pod, and we would use these forms to make sure that they get the right medication. So this is an example of a Dispense Assist form with the voucher pre-printed. So again, the individual went into Dispense Assist, they filled out their information, which is listed under the demographics section. They've answered a brief health history questionnaire, and then there's a space at the bottom for the client to sign. They would bring this to the site, and again, the form would tell the dispensing individual what medications could be provided to this person. For example, up here, this person can receive both ciprofloxacin as well as doxycycline. On this voucher, filled out by another individual, you will note the difference that they only list ciprofloxacin. Due to the answers in this health history information, this individual may be excluded for allergy purposes or another reason from taking doxycycline. This will allow the individuals at the pod site to correctly triage the right individuals to the right line to receive the right medication. And again, a third individual only able to receive doxycycline. It's important that folks who are working in a pod pay attention to the details to make sure that clients receive the right care. This form shows that the individual cannot receive either medication. You will notice that there are some allergy information questions here that were all filled out in the affirmative, and this person would have to be referred back to their primary care physician to receive an alternate treatment. Now, this is an example of the original NAPH form that the person would fill out in order to get medications for multiple members of their household. So again, there's a space that they would fill out last name and first name of the individual that they're picking up for. They would go through and fill out the individual questions for each person. And then if we receive this form, we would go through it and do the triage that the Dispense Assist program does in advance for those folks who use that site. All right, so the timeline for a pod. Pods are not created on the instant. They are very manpower intensive and require some careful pre-planning on the part of the Department of Health. Because these are large-scale events that require medications occurring when local resources are exhausted, the idea is that most people will go to their local provider or local hospital if it's a small-scale incident. If it is large and cumbersome and the folks in your locale cannot provide the services, that's when the health department would come into play. It takes a few hours to wind a pod up and recruit all the folks who would be staffing that pod. It requires a while for the state of Vermont to request assets from the Centers for Disease Control and to pull those in from areas across the region, as well as to contact the facilities that we have memoranda with and get permission to open that site. We would provide a call down drill for all of our health department staff and for those other Agency of Human Services staff who would assist us, as well as doing a call out to our Medical Reserve Corps using the responder management system. There has to be pre-advertising to let the public know that these sites are open, which involves our communications department, providing a media blast to let folks know what this is about, when it's taking place, and any prerequisites for them to attend. And then obviously we would designate a time for the pod to open and for us to continuously serve the medication to the public until such time as we felt comfortable that we had reached everyone who wished to participate. Now, when we open a pod, I had mentioned earlier that we have that lane with triage, intake, distribution, and exit. These are some additional support structures that can be added to a pod. As we know, something like a terrorist attack or a disease of high consequence can be a very stressful event. Sometimes that might require having behavioral health personnel on hand to de-escalate or to calm people who have fears regarding the medication itself or the event that caused the need for the medication. Sometimes security would need to be in place, particularly if this is a medication or a vaccine that is in limited supply to prevent theft, or if it was a terrorist attack to prevent the pod location from being a secondary target. If we have a large-scale pod with many moving parts, sometimes we have an individual staffing position who will make sure they're monitoring safety and rotating people on breaks and calling in supplemental staff or dismissing staff as the pod site contracts and expands. And we may add additional logistics and support issues to make sure that everything moves smoothly. So who supplies the pod? Medication distribution at pods will be provided to the state by a partnership with the Center for Disease Control and Prevention using product through the Strategic National Stockpile Program. The SNS is a large national repository of life-saving pharmaceutical and medical supplies that is available to all states and territories at need. It's there in case of a public health emergency, such as a pandemic or bioterror event, or an emergency that might affect the environmental quality of the area and lead to subsequent diseases. Any materials that are provided through the SNS is free of cost to the state and to the individuals who receive it. So briefly, I want to go through how we request the Strategic National Stockpile. You as a volunteer will not be involved in this process, but I think it gives you a good perspective on understanding how the process is escalated to the state and national level and how we receive the supplies that we do to do the work that we do. So we would open an emergency operations center, whether that's locally, statewide through Vermont Emergency Management, or through the Health Operations Center at the Health Department. We would make an official request for SNS material through that body as long as we have governor's approval. It's necessary to have the governor's approval in order to request anything from the federal government. If the approval goes through, the CDC receives the request and sets up a conference call with all appropriate parties who are responsible for the Strategic National Stockpile to make a determination on whether the medications or vaccines and support supplies should be distributed. So below in gray, you'll see this triage model where a series of questions need to be answered by the state to make sure that we meet all the criteria for receiving the stockpile. Presuming we do, then the supply would be provided to us and we would continue to go through this on a regular basis until such time that we had local capability able to take over and the SNS stockpile was no longer needed. So when people think pods, they think medication and vaccine. Unfortunately, sometimes there is a false perception of other things that a pod might do. A pod is not designed to serve as a medical treatment site. We do not have the privilege of knowing these individuals as patients and being able to provide complex levels of care. That is a function for our FQHCs, our local hospitals, our urgent cares to provide. This, again, is a rapid treatment model where we are doing one function and one function only. A pod is not designated to provide emergency medical treatment of any form, such as first aid or long-term care to sick patients. If we had somebody presenting to a pod site that was ill or injured, emergency medical services would be called. A pod site's also not designed to deliver vaccines and medications to prisons, nursing homes, or the homebound, or others that fall in this type of category. Remember back to the beginning that I mentioned there are closed pods. These types of situations would be designated as closed pod partners, where we would have personnel working in conjunction with other facilities to make sure that those medications were delivered or were provided on site by their own staff. A pod is designed for those who are mobile and able to get to it to be able to receive medications and then return home. So who runs a pod? The answer is whoever we have who is willing and properly trained. The Vermont Department of Health supervises all pods in the state of Vermont. We provide the core management team, which consists of a number of individuals that provide management level roles. First and foremost is your pod task force leader, who serves as the incident commander. You have health professions manager, who oversees all of the medical individuals who work the site. You have individual supervisors that are going to be overseeing things like medication distribution, intake, exit, so on and so forth. There's an individual who oversees the Strategic National Stockpile inventory, whether that be medication or vaccine. And then typically you have somebody who's going to provide logistical support and make sure that all the paperwork and the pens and the pencils and the syringes and the vaccination cards and all of those things are in working order and supplied to the tables. Next, you're going to have volunteers like yourselves. Due to the limited pool of staff available, Medical Reserve Corps is an instrumental component in making every pod work. We are heavily reliant on our volunteer capability, which is why this is a core training for MRC volunteers who are going to be active in emergencies. We would assign roles to you that you have a basic level of understanding for. However, once you are at the pod site, we provide what's called just-in-time training, or JIT, to give you a rundown in the more specific aspects of the role that you would be filling. And we would assign you to that role based both on your skills and comfort level, as well as whether you have a medical or non-medical background. The pod facility also supplies individuals. Usually there's going to be a head of facilities or custodial aspect where somebody is going to be assisting us in the setup and overall maintenance of that pod. Sometimes we have support from IT individuals who will help us with connectivity for our computers so that we can log our medications and our vaccines appropriately. Often there will be other folks in support of us as well. All right, so some general information. We are going to be supported through our Health Operations Center, which is our emergency operations center for the health department. We would have backup from other departments such as our communications division, perhaps from epidemiology or our immunization program, depending on what the emergency is. All of those folks would have a seat in the Health Operations Center and be able to provide an additional level of command and control to the folks like us that are on the ground running the pod. Information and media campaigns will be used to instruct the public during an event. We would be directing folks who are symptomatic to go to one location, those who are asymptomatic and potentially exposed to go to the pods, and we would continue to work providing information as it came forward, as well as countering misinformation. Within the pod, again, you can see this larger overview of all the potential places and parts that we would staff for a pod. We would have the task force leader, somebody providing safety and security, and then we would have these various designations for medical and non-medical folks. And we can expand or contract this depending on whether we're serving 100 folks that day or 10,000 folks that day. Depending on the incident, this is definitely scalable. So briefly, I want to go through each of the roles here. Again, as you are assigned to a particular role, you will learn more about it, but as a general overview, these will basically follow the same kind of structure. So your pod task force leader is responsible for directing and supervising all services and functions at a single pod. That may include but not be limited to screening, treatment, immunization, psychosocial support. This individual is overseeing the other managers within the pod who then oversee the employees or volunteers beneath them. Your safety person is going to be responsible for monitoring the pod, not only for the physical safety of individuals, but also for the safety of staff and volunteers. We are now playing an increased role in monitoring the psychological health of the folks who are staffing these pods as well, because we understand that these incidents can be incredibly stressful and that our staff and volunteers are managing expectations at home as well as through their professional lives and the work that they do. These are usually staffed by somebody from the health department, but could potentially be staffed by others. Security is there again to provide control to make sure that there are no threats from outside, but also to make sure that everyone behaves in an appropriate manner and does not cause disruptions to the pod. We typically have partnership with our local police or state police to fill this role, unless there's private security being offered by the site that we've contracted with. The security needs can vary depending on the type of event. Your intake or exit manager is going to be overseeing triage, intake, and exit, and they're responsible for maintaining an efficient client flow throughout all of the non-clinical areas of the pod. Your intake and exit workers can be staff or volunteers, and again, these are the individuals who are having direct client contact as individuals come into our pod. They are providing greeting services, they are providing access to the paperwork and interpretation of the paperwork. They are anticipating the needs of the clients, whether that might be a language issue, an accessibility issue, helping work through things like getting additional seating if it's necessary, directing people to the correct location. These folks are essential to making sure that the pod flows smoothly. Our health professions manager is a medical professional who oversees the individuals who are providing the medication or the vaccine at the screening distribution site. They are also there as a subject matter expert to answer questions that need to reach a supervisory level. A medical distribution specialist is an extra layer of supervision for extremely large pods where the health professions manager cannot direct supervise the medical staff underneath them. This individual may be responsible for overseeing 3 to 7 medical distribution workers, but again, they are there to provide direct supervision and to answer questions for the folks who are underneath them who would be working directly with the clientele. So your medicine distribution workers are the ones who are directly interfacing with your clients. They are reviewing the forms, they are deciding what medications the individual will receive, and they are also making sure that any reminder cards or vaccination cards or any paperwork that is necessary for the client to receive goes home with that individual. Sometimes these folks may have a scribe or helper to do the paperwork aspect while they focus on doing the medical portion, but that is something that, again, is a scalable function of this station. Occasionally, there may be a medical consultant available on site who provides more direction on the specific type of medication or vaccine, or answers some complex questions such as contraindications or whether there needs to be further evaluation for somebody who might have an elevated level of exposure. This is very rarely used. However, this can be built into a pod depending on the necessity of it. There is a mental health component again, which is one of our optional positions again, but they are responsible for scanning the clients as they come through, overseeing mental health of folks who are not coping well with the situation, trying to provide them some advice, some access to services. They are also available to our pod staff and volunteers upon need. If they have folks working underneath them for large-scale incidents, those folks would be mental health specialists, with the previous position being the supervisor. Our support manager, again, is the person who's overseeing all the logistical needs of the pod, making sure that the supplies and equipment are at the right place, coordinating with the host facilities, head of facilities management or physical plant to make sure that we have the right power and we have the right IT and the space has the equipment pre-positioned when we get there, so on and so forth. This person is the jack of all trades who makes everything run smoothly. And again, they're interacting with this person who's the facility logistics specialist, who is the one who knows the individual site best. If our support manager needs assistance for a large-scale incident, they can call on another tier, such as a supply unit leader, who would be the individual who would take the supplies in the logistics section and make sure that they were delivered out to the individual tables or pieces of the pod. They would also be able to catalog things that are running low and make sure they communicate back to that supply manager so that things were ordered for the next pod. And again, supply workers are another level of depth in working through the logistics process. These are all scalable functions, but again, each one can draw down and have a smaller area of responsibility for a larger scale incident. Our SNS inventory unit leader is the person who's responsible for processing the receipt of, ensuring the correct storage of, and making sure that the medications or vaccines are distributed to all of the appropriate tables in anticipation of our client throughput. This person is also responsible for ordering new vaccine or medications as necessary. Inventory workers may assist this person in labeling the medication bottles or drawing up the vaccines, keeping accurate logs based on drawdown from each of the individual tables, but again, scalable function depending on the size of your pod. Now, Sometimes volunteers are rolled under the task force leader as just part of the general staff. For an extremely large or complex incident, we can put in a volunteer manager who would oversee specifically volunteer positions. This individual would maintain the sign-in and sign-out sheet for our MRC volunteers. They would oversee the registration and placement of volunteers throughout the process. If we had queries about spontaneous or non-affiliated volunteers wanting to help, this person could interface with them and direct them to the MRC and get them started on application processes. But again, this is the person that we would rely on to be able to directly interface with you as volunteers if it was a complex incident. Now, the pod and the pod task force was structured in accordance with the National Incident Management Systems process using the incident command system structure. There is a reason that we ask all of our MRC volunteers to have a general overview of incident command, and when they become an active level volunteer to take both IS 100 as well as IS 700, which are the basic incident command system and NIMS trainings. As you've been able to tell from a number of these slides and org charts, having a unity of command and understanding the command structure is essential for making sure that this model works. If you have any questions or would like more information on the incident command system, please visit FEMA's training website. Now, again, a lot goes into pod operations. Pods do not just grow out of the ground. There are a number of functions that make a pod work. Before a pod operation begins, the pod task force leader should be provided with a field operations guide, which is an individual guide for each facility that they would use to set up a pod. Usually your pod task force leader is going to be the same individual who prior to an incident has met with these facilities and toured them and had interaction with their operations staff to make sure that this site is feasible. However, a task force leader does not necessarily have to be that individual. So we make sure that things such as field operation guides for each site, that the master standard operating guide, which tells us what criteria make up a good pod, and individual things like our job action sheets, our medical orders, and any event specific information are all included in a logbook at each individual site for reference by the pod task force leader, or in fact by any staff member or volunteer who needs to reference those documents. So your field operating guide is the individual pieces and parts to the site. It can contain things like communication, contact numbers for the facility, for local police, fire, EMS. It will have floor plans for the facility, flow charts that let the individual who's overseeing this pod know the best way to set it up, as well as any contingencies on how they could break it down to a larger or a smaller pod setup. It will have things like site delivery and logistics, whether the building has a loading dock, whether there's certain times of day that they have access, whether there's a key code entry. Module C is a security assessment that is done in conjunction with law enforcement, where they do a threat assessment of the building. They locate all of the things like access points that are publicly available versus not, locations of standpipes and fire extinguishers, whether there's on-site security or not, whether there's cover and concealment for anyone who might do harm to the building, whether the parking is easily accessible to the building or distant and people might need to be accompanied to and from their vehicles. All of these things go into the security consideration. But this entire packet with the base information, the facility specific information, and the security plan are all contained within that field operating guide. Your standard operating guide, again, is the master document. This is not site specific, and it covers the statewide protocols that are required to operate a pod, such as the overview on how a pod operates, what tasks must be done at all pod sites, what the proper communication channels are, and things like badging procedures for personnel. These types of things are all contained with the standard operating guide, which is the master document. Your job action sheets, again, are specific information that are tailored to the role that our staff or volunteers are filling. So who they report to, what their responsibilities are, recommended or required skills. These are a part of an appendix in the standard operating guide, but are often pre-printed and provided to the staff or volunteer directly at the pod site. And this is a very, very tiny example of what a job action sheet might look like. And it will break things into, what the mission is, what your immediate actions would be, what you're expected to do during the pod, how you would clean up the pod site at the end and sign out your shift, so on and so forth. It also has a skills section. So if we have a necessity that you're an EMT or an RN, then that would be specified there. If it's somebody with good communication skills or good clerical skills, that would also be listed there. Depending on the job, each section will be tailored to your needs. Now, medical orders. Medical orders are approved by the Department of Health, medical authorities, and they fall under our Commissioner of Health. That individual is going to work with subject matter experts to make sure that we have guidance on how to correctly administer the medications or the vaccines for the specific event going on. Medical orders specify appropriate medication for each individual, who can distribute those, and other important information. And then our event-specific information, or ESI. That is information that will be collected, created, and communicated by the Health Operations Center staff. Information in the ESI includes suggested modifications of client flow diagrams or pod station layouts, clinical guidelines, references to the medical orders, drug algorithms, staffing plans, et cetera, et cetera. Things like what personal protective equipment that folks need to use at our pod sites would be specified in ESI. Things like social distancing, things like whether there are waivers in place for additional types of medical or non-medical personnel to be able to distribute medication would be contained within this. So again, these are tailored pieces of information regarding the disease of consequence that we are dealing with. So this is where we're going to end our overview presentation online. Again, if you do have the opportunity to attend a pod overview with your Medical Reserve Corps unit or at your local health department district office, I strongly encourage you to, because this quiz and review of the content material will benefit you greatly. However, you have seen all of the main components that go into pod overview planning and the functioning of a pod. And throughout the year, your MRC unit will be involved in reviewing this material with you, with opportunities for additional training or participation in drills and exercises related to pods. Thank you for your time attending this training. Answers with you. So a point of distribution or pod is a place to. The answer here is D. Distribute medication and our vaccinations to the public during a health emergency.